Hi, I'm Dr. Skyler Holcomb, and I'm here with ATL Dental Implants to talk to you today about the differences between snap-on dentures and All-on-X. What are both of these options? Who might be good candidates? And how much do these treatments cost? What is All-on-X? Also referred to as All-on-4 or All-on-6 or full mouth implants. This refers to the procedure where we replace your existing teeth that are being removed either due to periodontal disease or decay with 4 to 6 implants, and we make custom teeth that are affixed to those implants that they stay in your mouth. They do not come out. Next, we've got a snap-in denture. Snap-in denture utilizes 2 to 4 implants so that the denture doesn't move around. You get a much higher chewing force than with a natural or a traditional denture, but still not as good as the fixed option, the All-on-X. But it's a nice little middle ground for someone who may not be able to afford the fixed option, but they want something better than the traditional denture. So what's best, fixed or removable? Well, it really depends on your situation. I'll go into specific points about each option so that we can figure out what's right for you. Well, let's talk about eligibility. Who's able to get fixed versus removable? There's actually a higher number of people eligible for the fixed option than removable, and we don't do removable for the upper because of the higher failure rates. If we're doing a snap-on denture, we only do that for the lower. Likely, if you've got your teeth, the best bet would be to get implants with the fixed option, because then you're not going without teeth. You're not making that big of a transition from having all your teeth to no teeth or getting used to a denture. That transition is a lot smoother when we go to the fixed option. If you're currently wearing dentures, a good option kind of in the middle is to go with that snap-in option for the lower that drastically improves your chewing function just by adding 2 to 4 implants on the lower to make your lower denture snap on. One of the biggest complaints we have for a lower traditional denture is that it just never stays. No matter who you see, it's the hardest thing to do is to get a well-functioning lower denture without implants. Another thing to consider when you're deciding between fixed and removable is when you've got something fixed, you have a less chance of having bone loss. With removable, your implants are not splinted together and they have the higher chance of failure and bone loss over time. So we need to be very careful about the decision we make and deciding who's a good candidate for what, because there's just a higher chance of failure with an overdenture compared to something that's fixed. Next, let's talk about materials. For your fixed option, the final teeth are made out of an extremely strong and really good looking material called zirconia. It's extremely durable. It allows you to eat just about anything you want. With dentures, on the other hand, we're using acrylic, which while it's still strong, it has a higher chance of fracture, so there's the higher chance of having to have the denture replaced. When it comes to these two options, the number of implants are different in these two treatment choices, because with fixed, we go from 4 to 6 implants so that we can support a full arch of teeth that aren't moving. And with the lower overdenture, we use 2 to 4 implants. Anything more than 4 implants for a snap-in denture, and the patient is not able to remove the denture easily, which likely leads to them leaving it in longer and making it harder to clean, which can cause problems down the road. Let's talk about bite force. With fixed, we're going to get 95 to 100% of your natural teeth bite force with the zirconia final teeth, which will allow you to eat anything that you've been able to eat in the past. With a snap-in denture, you're looking at around 50% bite force, which is greatly improved over the 20% from a traditional denture. The overwhelming majority of people are going to prefer the fixed option where they don't have to take the teeth in and out, and they don't have to worry about that. They get the strongest bite force and they're able to eat anything they want. But then there's also the patients that maybe have worn a denture for 20 years and they just want to upgrade to something a little bit more stable so they can eat a little bit more than what they have been currently. And they like the option of being able to take their teeth in and out and keep them clean in a way that maybe they aren't as comfortable with the fixed option. What happens after you've received your treatment for fixed or removable? What happens a year down the road? Well, for fixed, we see you once a year to take the teeth off and make sure the tissue is nice and healthy, that there's not any problems with the implants, that you're doing a good job keeping them clean. If you're not, then we can help provide tips and tricks on how to do that, or maybe recommend seeing you more frequently. For removable, you're more likely to be seen on a more regular basis just because the bushings inside of a removable denture need to be replaced, because over time, from taking them in and out, they wear down. So let's talk about what everybody wants to know. How much does it cost? Well, for your fixed option, the All-on-4, you can expect to spend anywhere from $15,000 to $24,000 per arch. And for the snap-on, you can spend anywhere from $7,000 to $10,000 per arch, keeping in mind that you're probably going to have more frequent maintenance visits, and so that cost can end up adding up over time. As far as our cost, you're going to find those clearly listed on our website, and you can expect to see that we're about 40 to 60% less expensive than the market price. If you did find the video helpful, then please give it a thumbs up and subscribe to our channel for more content like this. If you have any questions about the process, leave a comment and we'll be happy to help. And if you live in Georgia or anywhere in the Southeast and are interested in a complimentary consultation, please visit our website at atlimplants.com or click the link in the description below. We're also happy to do virtual consultations for those who live further away. Again, I'm Dr. Skyler Holcomb here with ATL Dental Implants, and now you know more about the differences between snap-in dentures and all-on-X dental implants.